My name is Dr. Carter Towne. I'm a gastroenterologist here in Memphis, Tennessee. I've actually been in practice for 40 years, in private practice. I was a member of Memphis Gastro. That dates all the way back to 1995. But then in 2013, we came together and ultimately merged in 2014 and became one big group, Gastro One, initially with about 33 gastroenterologists. Gastro One's the largest provider of GI services in this community. We really take care of Memphis, Arkansas, North Mississippi, and surrounding smaller towns between here and Nashville. Our goal was to be able to stay independent and make a big footprint in the area so that we could take care of the community. Fujifilm came to us 2 years ago, and we started using Fujifilm equipment. We have 15 rooms total in the 3 ASCs, surgical suites. In 2022, we did 28,000 plus colonoscopies and 12,000 endoscopies approximately. Personally, last year did 1,780 colonoscopies, about 350 to 400 endoscopies. The ability to work with us, to service us, to take care of problems, to be here on the spot. Our interaction with Fuji for the last 2 years, since we've exclusively gone to Fuji scopes, has been excellent. They made sure that we had the right equipment in the right spots and enough of the equipment so that flow was right. The maneuverability is what I love about the Fuji scope. And in 2 years, I've done 3,800 colonoscopies, and I missed the cecum one time with these scopes. It's pretty impressive to me. But to me, the most important part of it is the stress. In days past, with other equipment, that number might have been 15 to 20 times in a year. As you can see from the number of cases that I've done over the last 2 years, we have to be very productive in our ambulatory surgery centers, and turnover is an important part of that. So if I can get to the cecum in a minute instead of 8 minutes, it makes all the difference in the world. When you're doing, say, for instance, 12 to 15 colonoscopies in a session, then you're turning over faster, everybody else is turning over faster, and you can be more productive. And I think from a standpoint of timing, insertion makes a lot of difference. So when we're talking about upper endoscopy, it's very important to be able to see everything, retroflex, turn angles. You get in the duodenum and it's sometimes difficult, but the way the Fuji scopes maneuver is way different than what I was used to before. Before, I could not retroflex to look at the GE junction and get a decent picture close enough to the GE junction to document what I needed for the study. And with the Fuji scope, it's perfect. I don't have any problems. And that's a big part of your procedure. You've got to see everything. We've instituted the use of endoscopic ultrasound now in our ASC. We were able to make that decision because ultimately there's not so much windshield time driving to hospitals and back. It's much better for partners. It's better for patients. I've been in the business of helping physicians all along, and I did think that it was important that other folks understand that there's no need to be stubborn, resistant, or afraid to switch when there is that kind of good experience that can come from it.